Well, joining me now to discuss this is a Public Relations Officer of the Public Health Physicians of Nigeria, Dr. Blossom Madafokwa. She joins us live Zoom from Lagos. Thank you, Doctor, for joining us on TVC News at 7. Well, the Indian variant of the COVID-19 has been found in Nigeria, although with less viciousness. How worried should Nigerians be? I'm afraid we can't get the audio from Dr. Madafokwa's end. We'll try to reconnect with her. And
okay, can you hear me?
Okay, I can hear you, Doctor. I was asking.
Okay. Yeah. So thank you so much for having me.
All right.
So I mean, regarding your question, the variant has indeed been identified in Nigeria, as well as 6 other African countries, and it's designated a variant of global concern. It's actually called the triple mutant variant because it's suspected to have increased transmissibility. It may be more virulent, and it may be able to evade some of the vaccines that are already being administered. And if we suspect that the current surge in India may be due to this variant. So should we be worried? Absolutely, we should. And that's why the non-pharmaceutical interventions that we have been preaching from the beginning of this pandemic need to be adhered to very strictly. Wearing your face covering, avoiding gatherings with a lot of people, maintaining social distance, washing your hands regularly. These have to be adhered to because we're really concerned about this new variant.
All right, but as it is, just like we've seen in some reports that were broadcast in the course of this bulletin, we've seen gatherings of people, of course, more than 50. And well, yes, some of them putting on the face mask, but then not everybody. And social distancing was not exactly adhered to. How do we manage the situation so we do not get to a 3rd wave in Nigeria, because we've seen some countries even experience a 4th wave?
Yeah, I mean, you raised a very, very important concern, a concern for many of us, because we have some of these guidelines in place, wear your face covering when you go out. But we go out all the time, and you get to some places and people look at you and they're wondering, wait, why are you wearing a face covering? COVID is gone. So it's really concerning, and we need to continue to push the message out there. We need to find new, innovative ways to bring our message to the public. We need to use community leaders. We need to work with these communities. These people have really little confidence in the government. So we need to work with their leaders to bring this message to them. We must adhere to these non-pharmaceutical interventions, because some of the industrialized nations are having like very high vaccine coverages and really almost approaching herd immunity in places like Israel, for example. And in a place like Nigeria, where there's inequity in the distribution of vaccines, our biggest hope will be that we adhere to the non-pharmaceutical interventions. Since the vaccine coverage is extremely low, currently it's at 1% of the population.
Mm. Well, Doctor, let's talk about the continuous mutation of the coronavirus. There are concerns that a time would come when the vaccines we have now, the way we know them, can no longer serve for the new variants that would be coming up in days and months ahead. What do you think we need to do to be able to, manage this global pandemic?
Yes, that's a very, very good question. So this is why we need to stop this virus in its tracks, because the longer the virus stays with us, the more it mutates and the more we see these new variants. It's in the nature of RNA viruses to mutate because they replicate so rapidly. So you're replicating very quickly, they change the way that they are. So the best way to stop the mutations, is to stop the pandemic. However, you've raised something about vaccines not being effective. The beauty of the new vaccine technologies that we have today, like the messenger RNA vaccines, is that you can easily modify the vaccine to be effective against any new variants. So in times past, the vaccines that we had, you either use an attenuated virus to develop a vaccine, but now you have new and really fantastic technology. You can actually just go back to the lab and re-engineer that vaccine to be effective against the new variant. So that is the good news.
All right, Doctor, thank you very much for that insight at this time. PRO of the Association of Public Health Physicians of Nigeria, Dr. Blossom Adefokwa, thank you for joining us on TVC News at 7.
Thank you so much for having me.